Hi, my name is Allie. Can you tell me your name?
Sophie.
How old are you?
16.
Today you're in for a head-to-toe assessment. If you have questions at any time, just ask. Do you know who the president is?
Joe Biden.
Do you have access to 3 meals a day?
Yes.
Your posture is nice and straight. Your BMI is equal to your height and weight. You had a good gait walking in. Do you require the use of a walker or a cane?
No.
Okay. Your speech is clear and understandable. Is English your natural language?
Yes.
Okay. And your personal hygiene is good. Today we did an assessment on a 16-year-old female, a head-to-toe assessment. She was alert and oriented times 3. She had good posture. She reports she has access to 3 meals a day. Her personal hygiene was good. She denies the use for assistive devices. Her weight and her height were proportional to each other. We then assessed her skin, which was warm, dry, and intact. Her hands and nails, she had good skin turgor. Her nails had a capillary refill less than 2 seconds and were clean. Her peripheral pulses were strong and equal bilaterally. Her head was clean. No lesions or bumps or lumps noted. Her face, we assessed cranial nerve number 7, which was her facial nerve. It was symmetrical and intact. Her temporal artery was palpated. Cranial nerve number 5, her trigeminal, was intact. Her sinuses were palpated, both her maxillary and her frontal, and she denies tenderness on palpation. Her neck was symmetrical with no masses or tenderness. Lymph nodes were palpable and non-tender. Cranial nerve number 11 was her accessory nerve. It was intact with full range of motion. Her trachea was midline. Then we assessed her eyes. Cranial nerve number 2, her optic nerve. We assessed her vision. Her vision was demonstrated where she had good vision. We then assessed cranial nerves number 3, 4, and 6, which was her oculomotor, her trochlear, and her abducens. They were all intact. We assessed her conjunctiva, which was pink, her sclera, which was white, and her cornea, which was round and clear. Her pupils were equal and reactive to light and accommodation. We then moved on to assess her ears. Cranial nerve number 8, which was the vestibulocochlear. No drainage or irritation noted upon assessment. She passed the hearing test where we whispered. She was able to hear it bilaterally. Her ears were symmetrical. We then assessed her nose, which was cranial nerve number 1, which was the olfactory. Her septum was nice and midline, no drainage or irritation noted. We then moved on to assess her lips, which were pink without ulceration. Her buccal mucosa was pink. Her gums were nice and pink, and she had no inflammation or discoloration noted. Her teeth were white and were all intact. Her pharynx was pink. Her tongue, which was cranial nerve number 12, which was the hypoglossal. And then we assessed cranial nerves number 9 and 10, which is the glossopharyngeal and the vagus. Her tonsils were pink without any inflammation noted. Her thyroid was non-palpable and non-tender. Her lungs were, we auscultated both anterior and posterior, and her lung fields were clear bilaterally. AMP to T diameter, respirations were right at 18. Her heart, S1 and S2 noted. 5th intercostal space, left mid-clavicular line. Apical pulse was palpated and was right at 72 beats per minute. Her abdomen was soft and non-tender. Active bowel sounds noted times 4 quadrants. Her extremities, she had full range of motion in upper and lower extremities. Peripheral pulses were palpated. We then assessed her heel to shin, which was intact. Her Romberg was negative and her patellar was positive. She had a negative scoliosis screen, and her spine was midline. We assessed her shoulders, her scapula, her elbow gap, her iliac crest, and her gluteal fold, and they were all symmetrical.